Live from Studio B and KPRC2. Houston Live starts now.
You know, the silver lining, though, we got Botox on the show today.
Yes.
Our friends from the Institute of Anti-Aging are in the house. Oh, yeah, we got some applause in the back. You get Botox and you get Botox. Okay, Sarah Pepper's in the house. She doesn't need any Botox.
No, she doesn't.
Fine.
You know what's so great, though, is people always ask me, oh, are you going to go get Botox, like, on your lunch break? And our show airs during a lunch break, so lunch break is a little bit difficult, but I had it done before the show. And you can't even tell. Like, not even 30 minutes ago.
There is a little bump immediately. Well, not on you, but I'm saying immediately when you do it, there's a little bump, and it goes away within, like, 2 minutes.
Yeah.
People are fascinated by Botox.
Yeah.
And I was always one of those people who was like, I'm not going to do it. I want to look natural. And even when people find out, friends or viewers or whomever, they'll say, well, you don't need Botox. It's because I do it. It's because my face is loaded with... I've told you this story before, and our viewers probably know it, but I love it so much, I'm going to tell it again. So Samantha, my youngest niece, who's 8 years old, she and her sisters were staying with us down here in Houston, and we were leaving KPRC one day in the car, and from the back seat, after asking me how old I was, Samantha says, Uncle Derek, how much Botox do you have?
Oh, my, well, why would she ask that?
I don't know. I said 75 units, Samantha. Every time, all over here. So in the New York Post, there's a story about this woman who is a registered nurse, and she does Botox, right?
Okay.
So she and her husband were married for 20 years. They recently divorced. Their divorce was final in January. But guess what?
What?
She's given him Botox.
Why?
I think this is the sweetest story ever.
The ex-wife is giving the ex-husband Botox?
So she's a beautician named Sophie Kennedy. Her husband is named Angus. I feel like these people are my friends.
Them, yeah.
I'm so invested, right? So she already has a new man. He's on the market to start dating again.
Okay.
So she wants to help freshen up his face and give him just sort of like a more youthful look. Get rid of some of the lines.
Nice. Shouts out to nurses, by the way, for Nurses Week. But that is
Happy National Nurses Week.
So brilliant, because she's like, you need to just get out there, and this will help relax your face. I feel like it does, especially for people who have... And you don't mean to make an angry face all the time, but if you use these muscles, and in a lot, the 11s is what they call them, it tends to come off as grumpy, right?
Gives you RBF.
Exactly.
We'll let you figure out that acronym for yourself. Men can get that too.
Absolutely.
Well, and in fact, so in the boardroom, it's interesting when you look at like Botox and cosmetic procedures in the workplace, because there are some people who have this constant like mean scowl. And if your vibe is like, if you're a boss or a manager and you want your employees to, I don't know, not be afraid of your scary face. You could do something about it. So, in all seriousness, though, the Aesthetic Society says procedures, non-surgical procedures like Botox, are up 44%.
Oh, that's wonderful.
And we saw that during the pandemic, that people were staring at themselves more at home in those little Zoom screens. And so I say go for it. And,
I do, too.
It's across all demographics that it's gone up, and we are going to be doing live injections on the show later
today. I'm really excited for.
It's
really
so
excited
fun.
for that. But there is one more story about Botox that I want to mention while we're on this course. Botox, they say, can actually help with depression.
I've heard this.
And I want to get this right. So this is from scientists arguing that by halting the negative emotional feedback and getting Botox, it may be useful in the treatment of mood disorders and depression. This is according to Euronews.com. Now, Botox may help alleviate the symptoms of mental health conditions, primarily because they use these muscles in your face to relax. And I guess we'll have to ask Dr. LeConey about it, but it sounds like it's going straight into these areas that may help relax your mood as it's relaxing these muscles, right?
See, that makes sense to me too. I feel like if you always have like a scowl on your face, that somehow must be... tied to like what's going on in your brain.
Exactly.
Right? But if you're smiling and trying to put out a good vibe, maybe you're also feeling better.
Yeah. Welcome back to Houston Life. Well, if you are looking for a way to pamper Mom this Mother's Day, maybe give her a little bit of confidence boost, help her skin get back to that youthful glow, a trip to the med spa is a great gift idea.
It totally is. Our friends over at the Institute of Anti-Aging Medicine and Skin Spa are the real experts when it comes to helping you look and feel your best. Here with a look at some of the Botox and filler treatments they offer, Dr. Richard LeConey and his patients, mother and daughter duo, Sophia Budenhagen and Anastasia Renya, along with nurses is Nancy and Aaron, our friends.
Hi, guys.
By the way, happy National Nurses Day.
Yes.
Y'all are trained professionals, and Dr. LeConey, you qualify as well. 39 years as an ER doctor. Let's talk about the idea of just enhancing your look. A lot of people are hesitant, Dr. LeConey, when it comes to doing fillers or Botox, but the name of the game at the Institute of Anti-Aging is natural.
Right.
Natural. And we live in the age where, you know, things that required a trip to a plastic surgeon years ago now can be done with, you know, injections, needles, you know, basically.
And you mentioned that, and I want to specify things like rhinoplasty can be done with injections.
Well, you know, you can make some nice tweaks to someone's nose that would have required plastic surgery. You can kind of eliminate the hump by filling it. You can do all kinds of little things with it. You can turn up the tip of the nose. You can do all these kind of cool things, and it's fun to do.
You're kidding.
Oh, yeah. It's
okay.
And people just love it. I mean, you wouldn't believe that when they look in the mirror, they go...
Can we talk about my forehead? How does my forehead look, you guys? Because not even an hour ago, I was in the Botox chair, and you can't even tell that I had anything done.
Yeah.
But it takes a while to settle in.
It does take a while to settle in.
Well, yeah, it's going to take a while to work, but the little bumps are gone in a few minutes.
Bumps are gone, but in 2 weeks,
no one
it'll be perfect. Yeah. Okay, Sophia, let's talk about what you had done earlier, because before your trek over to Houston Life, at the office of the Institute of Anti-Aging, you actually had, what, half your face done? Okay.
That's right. And then we ran out of filler. So,
so tell us exactly, for our viewers, Dr. LeConey, what did you do to Sophia's already very beautiful face?
Okay. Well, you know, it's kind of, we have the before and after almost just right here in one. So this is the other side that we haven't touched yet. And what Sophia's has evident is just the loss of volume that occurs due aging. And I think we talked maybe a little weight loss or something like that, because they can kind of do the same thing. You lose a few pounds. Unfortunately, it kind of comes, some of it comes from your face.
Oh, interesting.
And then and, you know, and when you're 22, boom, your skin tightens right up after. But for those of us who aren't 22 anymore, then, you know, it starts to sag a little bit. So we kind of reinflate it, basically.
And this is where, specifically under the eyes, around the cheek area?
Now, if kind of look right here, this is what we call a tear trough, okay? So it's kind of deep, and all required was a CC, just one little CC, and we put it right there.
And we're seeing some video right now of what you added to Sophia's cheeks, right? And also the lip area.
Right.
Is this and the lip area can also be a problem.
And this is how fast I do it, too.
Well,
amazing.
Time-lapse video. But the lips are also an area where volume, as we age, can be lost.
Absolutely. You know, some of us aren't born with any lips at all. But even those who are born with lush lips, by the time you get to 40 or 50, you might see some deflation, you know. And so that's where a little tiny bit of filler comes.
I want to mention really quickly the tear trough, because I don't know if a lot of people know exactly what that is. I have severely dark hereditary circles under my eyes, and that is something that you would suggest that would help out with that, right?
All you got to do is put a little bit in there. It takes very little for tear trough. You know, they say a syringe has about the same amount as a blueberry, but half a blueberry works pretty well in a tear trough.
Okay. How about the other half of Sophia's face? So I understand, Aaron, you're going to be working.
I am. I'm going to inject some Botox for her today, so that in a couple of weeks, not only will her filler look amazing, we're going to finish her filler at our office in after we leave this
later today. Okay.
But we're going to do some Botox right now.
Okay. So why don't you go for that?
Relax her little wrinkles around her eyes.
And Aaron is such a trained pro. All the injectors at the Institute of Anti-Aging, it really is not only about the great product, it's about who's putting it in your face.
Absolutely.
You don't want to get like a, you know, side of the road Botox job, right?
No kidding.
Please don't.
No. Everybody, Aaron, Nancy, everybody you see here, and all the rest of the crew there, they've been doing injections of Botox and fillers for 10 years plus.
Yeah.
I mean, these are seriously seasoned.
They've seen a lot of faces.
Right.
Okay, while Aaron continues working on Sophia, what do you say we take a quick commercial break? Because Anastasia, Sophia's daughter, had something really interesting done earlier, a little bit of chin enhancement, so the jawline is a little more prominent. Is that right?
Just balanced, you know?
Yeah, I like that word.
Balanced to manage, you know, kind of fit the rest of her face.
Perfectly balanced. We're going to show you how it's done. Don't go away. Houston Life will be right back. Welcome back to Houston Life. We are back with our friends from the Institute of Anti-Aging, along with mother-daughter duo, Sophia and Anastasia. So Aaron's been injecting Sophia down there. Half her face was done earlier with fillers by her cheek and lips. Now we've moved on, Dr. LeConey, to Nancy DeLone. It's great to see you. And tell us what you're doing on Anastasia here.
So what we're doing today is we're going to be doing a lip flip. So we do it usually in 4 points, like right here, right here, right here, and right here. And it just helps roll the lip out a little bit. And then we're also going to be treating her gummy smile. So when she smiles, smile really big, Anastasia, you can see a lot of her gums. So we're going to relax that so it doesn't pull as much and she won't be able to see as much as this. And then we're also going to be doing her chin.
We're seeing some before and after photos, by the way, on the screen. So the chin was actually first treated. I mean, the chin, this is a huge difference.
Absolutely.
In just a matter of a few weeks.
Yes.
So Dr. LeConey mentioned balancing the face before the break.
Yes.
Absolutely. Yeah, balancing, because the chin was just a little bit set back, where this gives the whole thing a nice classic balance and good looks. And something I'll mention, again, doing the chin was something that required a plastic surgeon only a few years ago. Now, just kind of like the nose, little tweaks.
Incredible.
And this is with filler.
Yes.
Fillers.
We did two.
Just a syringe and some fillers.
Okay.
So we did 2 syringes.
And it lasts for 2 years.
A filler in
2
her
years. Wow.
Yes. We did 2 syringes of filler in her chin, and then we also did 1 syringe on each side for her jawline.
Nancy, we'll let you get to work on Anastasia.
Oh, sorry, I apologize. And then today we did, like her mom, we just did this side. We did her under eye, and then later today we'll do this one.
Little bit of under eye that helps the skin.
Yeah.
How do you feel, Anastasia, so far?
Good.
Feeling good.
And Mom Sophia, you doing okay?
Feeling great.
Okay.
Good.
Yeah, a strong jawline is something that's becoming very, very fashionable and chic and everything. And so what we did here was what Nancy did so skillfully, is just put a little bit of filler right here to widen this area a little bit, give it a little more prominence. Balance is another word.
And natural, right? Natural is still
totally
the key.
natural.
Yes.
Yeah.
You mentioned the concept during commercial break, Dr. LeConey and Nancy, of a gummy smile. A lot of folks, when they smile, maybe they have beautiful lips, but their lips almost roll up and you see more gum than you see
Correct.
the lip.
Yeah.
But you can fix that using injections?
Yeah, and that's previously, there was no treatment for that.
Yeah.
And basically, you just put a little Botox up here, just below the nose, and what it does is it weakens the muscle that elevates your upper lip. When people are born where they have such a strong muscle there, it literally shows all their gums, too, and that, that's something they don't like.
Yeah.
So we can fix it.
And Nancy's
Little
treating
shot.
an area that sometimes is called, what, the orange peel on the bottom
People,
of
when
their
they
chin?
talk, they dimple their chin. It looks like a a peach pit, like a freestone chair. A freestone.
Oh, my goodness. Well, I'm told that I have a special gift waiting for me somewhere here in studio.
Look,
Is that
there's
right?
a chair for you, Derek.
I think I saw some Botox with my name on it.
Step to this side.
And I started doing
there you
Botox
go.
probably, I don't know, 3 or 4 years ago with y'all. A lot of people think that Botox fills in the creases in your forehead, but as you just mentioned on the chin, it's relaxing your muscles so that you can no longer create those creases yourself.
That's
Botox
right.
It's still kind of
And
working,
the longer that you do it, the more your face tends to adhere to the Botox, right? Kind of.
Because your muscle weakens over time,
Yes.
is that right? Your muscle atrophies?
It can weaken over time, and if you quit the Botox, it comes back. But, here we go.
Everybody in the chairs getting Botoxed up and filled up. Ladies, you look fabulous. Derek, I know you're going to look fabulous as well.
I feel great.
How does it feel so far?
It feels good.
Okay. Looking good. Houston Life will be right back. How are you feeling, Derek? Your forehead's looking good.
I feel great. How am I looking?
Looks good.
Looks good.
All right, y'all.
Mosquitoes.
We'll see you back tomorrow.
Thank you, ladies.
Mosquito bites, they go away.